Hello, everyone. Thanks for joining us today. Sudhir and I wanted to put this together because we're seeing some great responses to therapies that we're doing when we're doing combination therapies for an integrative approach to deal with pain. We've seen better healing, recovery, and we're excited to talk to you about the innovation as well as the novel therapies that we've been using. Um, so with that, let's get to it. Next slide.
Yep. All right. So, why isn't my pain getting better? This is a very common question I get asked, and the key is identifying which mechanisms are actually promoting the pain. Here are some main causes: persistent ongoing inflammation, mitochondrial dysfunction leading to low cellular energy, poor circulation and poor oxygen delivery leading to tissues being tired. Nervous system gets sensitized. And sometimes this sensitization can lead to central sensitization, which causes for an overwhelming nervous system response. You can have tissue damage, which then slows repair, oxidative stress, which can lead to all of these things, autonomic nervous system dysfunction, which can cause for a imbalance of your sympathetic and parasympathetic tone and your body's ability to heal and restore, and immune dysregulation. The key is to identify which mechanism is most dominant and attack it from that approach.
So why don't we look at each of these? First one is persistent inflammation. And, you could see this with joint pain, obviously just discomfort, pain, redness over the joints, inflammation. Morning stiffness is a big one where you're stiff for more than about 10 minutes in the morning. It takes about 10 to 30 minutes to feel better. On your labs, you can see elevated markers of inflammation. Even though the cardiac CRP says cardiac in the name, CRP elevation is a non-specific marker of an immune system elevation that's linked to a cytokine called IL-6. And so you could see sometimes these markers, but it doesn't mean if you don't have that marker up and you have a lot of pain, it doesn't mean you don't have anything to show for it and it's in your head because the CRP only follows the cytokine really that's related to IL-6. There's many other cytokines that can be elevated. Things like autoimmune disease have inflammation. We're seeing a lot of pain with long COVID and then chronic tendon changes that are called chronic tendinopathy. And again, our goal is to reduce inflammation while promoting the repair.
So, which therapies actually target inflammation? Um, we've got NSAIDs or non-steroidal anti-inflammatory drugs, which have been around forever. They reduce prostaglandin inflammation, but have potential side effects which can lead to kidney disease, gastritis, or peptic ulcer disease, and increased blood pressure, leading to cardiac problems. So, really, NSAIDs are a decent option to put out an acute fire, but if you're dealing with them on a long-term basis, it's probably not the best approach. Chronic use of steroids or acute use of steroids are a great way to decrease inflammation, but similarly, they have their own underlying issues. Our body makes a certain amount of cortisol, which is a steroid. We need that for immune function, for blood pressure control, and a bunch of other organic functions. If you have too much cortisol or steroid being pumped in from the outside, our bodies stop making steroid and your body can tank. So, chronic use of steroids is not recommended. We do use it in certain cases with pulmonary disease and rheumatological issues, but we use it very sparingly. And from a pain management standpoint, it is great for putting out an acute fire, but not something we really want to promote for long-term therapy. So we want to look at other ways to treat. And the list here is really looking at and attacking pain and inflammation using alternative modalities. Um, so we want to activate different healing pathways. NRF2 is a master regulatory protein which acts as a biological switch to turn on your genes that protect your cells from oxidative damage. It promotes cells to produce potent antioxidants and detox enzymes. An example of this is in food is curcumin. Another option is downregulating your N kappa or NF kappa beta, which is overregulated. NFKB is also a major regulatory protein, but when it's overactive, it can cause chronic conditions like rheumatoid arthritis.
Yeah, we found that combinations of these things like sauna and ozone, when we use PRP and people combine it with other modalities like sauna and ozone in addition to that. It really works well. But the foundation I always like to talk about is the elimination diet. Remember that food, our immune system is 80% in the gut. So the thing that we signals that we give the gut on an everyday basis is our food. So if our food signals to the microbiome in the gut are negative, we're going to turn on genes that increase inflammation. Just the same, if we gave the food, feed it the foods that are healthier, but also eliminate the most inflammatory ones, we're going to shut off some of that inflammatory signaling. So I always recommend an elimination diet for at least 4 to 6 weeks and slowly introduce foods back so that you can see what in your gut at the moment, based on what's going on for you, you're sensitive to. It doesn't mean you're allergic. It doesn't mean you have to avoid the foods for the rest of your life, but it does matter what signals we're giving our gut. And the majority of those, at least to the gut, is through food. So ozone modulates inflammatory cytokines and improves oxygen uptake or utilization. It's a new therapy that we're going to be offering at Shakti and through for patients with at PASS as well as for Shakti Wellness Center. So, look into getting some more information about that. But it does modulate the inflammatory cytokines and improves oxygen uptake in a lot of the tissues, not just muscles and tendons. Sauna through the heat and infrared light helps lower cortisol. It also helps the mitochondria, which helps with inflammation. PRP has a massive concentration of signaling protein and growth factors that suppress destructive inflammation, but it also works on NF-kappa B blocking. Other things that work on that are boswellia and herb, omega-3 fatty acids, and also the PEA, which is a very strong binding. It binds with the nuclear receptors and decreases the NFK K beta pathways, which all together can decrease your inflammation and pain.
Key reasons to both inflammation and accelerating aging is the mitochondria. This organelle not only makes our energy, but also has a huge role in immune function, muscle mass, glucose regulation. Our goal is to increase ATP production and cellular resilience. These are just some of the symptoms which suggest that your mitochondria are not functioning well. So that would be aging-related changes, fatigue, exercise intolerance, diffuse body pain or fibromyalgia, a slower recovery than you normally are used to, are all things that could lead to sending signals to look at mitochondrial health. Joe, the other ways to assess that easily?
So, assessing mitochondrial health is a little bit more challenging, but in our practice, we're using certain nutrient testings like Nutrival, which look at energy pathways. It looks at the Krebs cycle and the acids that are associated with the Krebs cycle. Then you can see relative deficiencies in certain nutrients, which are critical players in the mitochondrial pathway, like thiamine, like riboflavin, like things like precursors to like even the food needs in order for proteins, fats, and carbs to be getting into the Krebs cycle, they need things like magnesium and B complex. They need lipoic acid. They need nutrients that are sometimes deficient. So the nutrient test can give us an indirect look at the mitochondrial dysfunction. We're hoping to get testing that looks at NAD and NADH ratios, which are really more significantly associated with direct mitochondrial measurements, but it's still in the works. So we will hopefully get that in the future so that we can measure it more directly. But going to the next slide, let me see, is really what are we going to do when we find that the therapies have it? To be honest, and at Shakti Health and Wellness, anything that's associated with chronic illness, anything that's associated with accelerated aging is really dealing with mitochondrial dysfunction. It affects glucose, insulin, affects our immune system, it affects our muscle mass, it affects our energy production, it affects every organ's efficiency. So it's probably that most people that are coming in the door, even if you're completely well and you say, hey, I just want to learn how to age better, one of the reasons we age faster is because of lower mitochondria. So these are the next slide shows the tools that we can use for energy production, and your body relies on the mitochondria to make energy or ATP, and these therapies are designed to help them mitochondria in different ways. So light-based therapies can activate important enzymes within the mitochondria to allow your cells to produce more energy and reduce damage. And if you kind of feel overwhelmed with this particular webinar, we have both made similar webinars that go over some of these tools. For example, another way to support the mitochondria is sunlight. And there's a webinar out on the YouTube channel that's for circadian rhythm. There's a webinar for saunas. There's a webinar on the last one we did was on knee and regenerative medicine, where we go over some of these again, and we have one on the Biocharger. So some of the things that you're hearing in this particular webinar are separately discussed in their webinars kind of devoted to themselves. So check out things that you find interesting and maybe delve into it a little bit more with the other webinars. So SS31 and NAD are hot on the internet right now. SS31 is a peptide. It has a role. It works on a specific pathway within the electron transport chain on the mitochondrial membrane, and it allows for energy. NAD is also very well discussed on some of these websites. It can be given orally, it can be given IV, it can be given subcutaneously. Also, there's precursors to NAD called 1-NMA, sorry, NMN, and other ones that kind of stop the NAD from breaking down too quickly, like 1-NMA and apigenin. So you can use combination therapies to support the mitochondria, but in a lot of people who have a lot of pain, just NAD by itself or red light therapy by itself doesn't work. So what we like to do is combine these therapies to help your body create a network of things, kind of like when you have high blood pressure and we have drugs that are, causing salt to be lost called diuretics. We add things that help dilate the vessels going to the kidneys called ACE inhibitors. We have things that slow down the heart rate and blood pressure like beta blockers. So we use combination therapies and lots of things in medicine. So, for pain also, we can use different modalities to try to, help you reduce your overall discomfort. So there are some key nutrients that also help with the mitochondria. This is CoQ10, carnitine, lipoic acid, magnesium. Some of these we measure in that nutrient test that I was talking about. Other times we give it to people because CoQ10 is depleted in people who take statins and metformin. So if you're on those meds, typically we'll be telling you to take those so that you can support your mitochondrial health because that's getting depleted. So what do you feel when you support the mitochondria in a good way? You see better energy production, you see repair and recovery happening faster, you see reduced oxidative stress and inflammation. You just kind of age differently. So that's the kind of benefits that we're looking for. Next slide.
I would say that, when patients in the traditional pain management world come to see us, they're frustrated because their pain has been there for years sometimes, and they've undergone injections, physical therapy, surgery. They're on medications, and they're looking for alternative therapies, alternative treatments, and or they're frustrated as to why they go back to the surgeon and they say, "Well, the hardware looks great, the knee replacement looks great, the spacing looks great. It's not the surgical. There's no surgical solution. The rods and screws in your spine look great on X-ray, but you're still having chronic nerve pain. You're still having chronic pain that's debilitating." I think one of the things that people are missing is everything we just said in the last couple slides, is that we need to dig deeper and we need to ask the right questions and get the right data and the right information. So that NutriVal test that we mentioned as an example is an excellent starting point to look at your vitamins, minerals, and nutrients to see what's actually causing an imbalance. Also looking at your hormones, which we'll get to, but looking at what the root cause of where your pain is coming from and why you continue to have inflammation, but also why you're not recovering as quickly as you used to. I hear too often, I did this 10 years ago and I was laid up for a weekend and I bounced back. Now, 10 years later, I went out and played a round of golf, and it's been 3 months and I have not recovered. And I think a lot of that comes down to, sure, the anatomy and the biomechanics is a big part of it, but it's the underlying biochemistry that people don't understand all the time or aren't looking for it. And this is where all this stuff comes into play.
Yeah, it's good points. And another big reason why people don't heal as they get older is poor circulation and oxygen delivery. Remember that when you're in chronic pain, when you have chronic input to your nervous system that says that this part of the body there's something wrong with it, there is a sympathetic overdrive that happens that shuts down oxygen delivery to certain tissues so that your brain is basically trying to save energy and accommodate the vital area. So if something is chronically upset in terms of the fascia or the muscle or the tendon, the oxygen delivery to that area will be decreased. And so the poor circulation, it doesn't look like gangrene. It's not going to look like your foot's about to fall off. It just looks like poor recovery. It looks like swelling that doesn't remove. There's skin discoloration. If you got a cut, it doesn't heal as quickly. So these are very common clues to say, okay, there's poor circulation here. Sometimes neuropathy can be as a result of not having good circulation to areas. Of course, temperature changes, skin changes, and you'll see here a term, you have vascular insufficiency. That's definitely a clue that you're not getting oxygen delivery in the larger vessels as well. Next slide.
You know,
So, yeah,
we do
sorry, go
it.
ahead.
We do a test called the TM flow test that is a very simple, quick 10-minute screen to assess your heart rate variability. So it looks at what's going on with your adrenal glands and your sympathetic and parasympathetic tone. It looks at ankle brachial index, which looks at your blood flow in your extremities. And it also does a pseudomotor test, which is a neuropathy screen or test to see what's going on with how the nerves are actually sending signals in the arms and feet, which is a great way to get a snapshot or a screen of how your organs are actually working because they're all working together. And as we can identify dysfunction sooner, we can intervene and do things about it. So these types of diagnostic tests can be very helpful.
Yeah. And so, what are our tools right now for when we see these? So, neural therapy has become a really big part of my practice at Shakti now. Neural therapy uses procaine, which is an anesthetic similar to lidocaine, but it only has a 20-minute half-life. But so that's not what we use it for. We don't use it for the anesthetic part. There's something about that chemical that has this wonderful ability to communicate with the autonomic nervous system that says that I am safe. And so it has been very helpful to get the patients back into thinking in the kind of um, out of the fight or flight. When you're in chronic pain, you're going to always be kind of in a fight or flight state. But when you tell your body you're safe, when you go into rest and digest, that's when you can actually promote those healing mechanisms to become more efficient. So the other thing that it does is it improves oxygen delivery to that tissues because it's speaking to the fascia. The fascia is the covering of most of our tendons and ligaments and muscles. And it looks like if you peeled back the orange, it's the white part that you see that's surrounding the orange. And you can't really see fascia on any imaging. So you don't know what the fascia is, but it tends to be that the fascia gets very disrupted when there's a chronic injury. And fascia speaks to any fascia all over the body. So something could be happening in your foot, and you could feel it in your shoulder. So it's a communication system through the whole body, and so neural therapy really helps and speaks to the fascia. Ozone again improves the red blood cells and the flexibility of the red blood cells and enhances oxygen release into the tissues and joints. We can do it as a trigger point. You can do it as injections into the joints itself. You can even do it as an IV. So those are wonderful tools. Infrared light also causes nitric oxide, which is a gas that opens up our blood vessels and increases oxygen delivery. And IV hydrations, IV nutrients, just because of what Dr. Rao said, is that, when you get those nutrients back in, your mitochondria works better, your efficiency of your organs work better, and even your blood, your anatomy of your arteries and veins work better. You're going to get better delivery of nutrients and oxygen to your tissues, and it's going to enhance recovery.
One comment on neural therapy, we've been doing that now, I think, for about almost 2 years in our practice, and I was pretty skeptical when I first learned about it, but I was able to see firsthand some amazing responses where we're injecting around scars, and scars can really cause for a disruption in your biochemistry and your biochemical signaling through the fascia. That disruption can lead to pain in places that you would never even consider. For instance, I did a neural therapy injection, which is just a subcutaneous, just under the skin, super simple injection with procaine and anesthetic. And it's not meant to numb anything up. It was meant to actually depolarize and open up the cells so they can actually send these signals between each other. But the patient had ongoing, really bad plantar fasciitis. I did a chest wall injection from a chest surgery, and the pain in the foot went away. We had a patient who had this bad dog bite and had multiple foot and ankle surgeries. We did an injection around that dog bite itself and some around the foot injections. And not only did the foot start to become less swollen, but there was more range of motion. The physical therapist was impressed, said, what have you been doing lately? Whatever it is, keep doing it. And I had a patient who had major high cervical fracture and reconstruction, ongoing neck and full body pain, injecting around the spine itself from head to the lower back, really allowed for more clear thought, less brain fog, more energy, and less pain. Neural therapy is something that I think is very underutilized in the States. It's been around elsewhere for a long time, but if you're suffering from pain in any body part, you really should consider including it.
Yeah. Yeah.
Tissue damage and impaired healing. So how do we know that you're having or you're suffering from impaired healing? It could be that you have a ligament injury or a tendinopathy. It could be post-surgical recovery that's delayed. You could have EDS related changes, so hyper laxity and flexibility of your ligaments and joints can cause problems, and you can have arthritis. All of this can be a sign that you have ongoing tissue damage and you have a difficulty with repair. So tools, how and what are we going to do to start stimulating regeneration? The list here is peptides, PRP, and exosomes. So exosomes are, are, are potentially used for helping with joint degeneration, ligamentous injuries, tendinopathies, or even post-surgical recovery. Really looking at inflammation and trying to drive home decreasing inflammation by activating different signaling in the body to promote healing. The mechanisms are going to be able to deliver growth factors and signaling molecules to the injured areas, recruit repair cells, modulate inflammation, promote new blood vessels or angiogenesis, promote blood vessels to bring oxygen to the damaged tissue, bring better blood supply, but also remove toxins and get better flow to that area. Um, this will lead to tissue and ligamentous healing and also tissue regeneration. So these peptides, BPC 157, TB 500, GHKQ or KU, also known as GLOW, this combination of peptides has become extremely popular in the last year and a half, and we get people coming in asking specifically about these all the time. To be clear, we want to make sure that they're sourced from the right place. We want to make sure that you're taking the right dose. We want to make sure that you're looking out for any type of interactions with other medications and or other conditions. So BPC leads to increased blood supply, improves healing, and enhances tissue regeneration. TB500 is about tissue remodeling. It helps with wound repair. And GHKU helps with collagen synthesis, tissue remodeling, and also wound healing. So used together, they form a very good trifecta in any type of injury recovery.
Yeah, and remember, if you guys want more information, the last webinar we did was on exosomes and PRP. So there was a whole section on that, and we go into details about studies and what it's indicated for, things like that. So the next slide talks about the Biocharger. We added Biocharger to our protocols to aid with pain and inflammation. It's a really unique therapeutic system that uses pulsed electromagnetic fields. It uses light frequencies. It changes voltage and frequency based on harmonics that are found in nature. And there's literally 1,500 programs in this machine that can aid in pain pathways, inflammation pathways, detox pathways, recovery pathways. We're using it now to help with weight loss, detox, increasing energy production, creating balance for people, lowering anxiety. I think it's a great tool. It's not by itself a treatment. I think it's part of other things that we added to. But how have you felt about it, Sudhir?
I love this thing. I think this is one of the best things we've gotten in the last year. I love this so much that not only do we have one in the office, but I got one for my house.
Yeah.
I get more energy with this. I feel better. I feel like I probably work 80 hours a week, and I feel like that is no longer as taxing. Um, we've seen patients who've had post-surgery use this, and they literally are able to get rid of toxins quicker. They are able to recover faster. Their surgeons are curious to see what they've been doing. Combining this with peptides is fantastic. And it also has mental health purposes as well. So we've had patients who rely on this for anxiety treatment. They've maxed out on meds, on therapy. They've tried different types of anxiety related treatments, but the biocharger helps hone that treatment and allows them to function at a higher level. So I think single-handedly, and this is easy. You just sit in front of this thing. You don't have to do anything. It's anywhere from 7 to 20 minutes, depending on what you're trying to accomplish, and you can do it a couple times a week.
I
So if
think
you
the
can't
hardest thing
tell,
is
I
you
really
cannot
like
have
this.
the hardest thing is you cannot have your phone with you. I think that's for some people is hard. But you have to take any sort of devices away that can be potentially damaged by those frequencies emitted by the biocharger.
Those seven
Um,
minutes of no phone around is good for you.
yeah. Next slide.
All right, nervous system desensitization. Now, this is in a chronic pain world, when we're looking at how the nervous system responds and sends signals. This is probably one of the biggest issues that people understand the least. So, uh, you have an out of proportion pain um, to a limited tissue area is where it gets confusing as to what could be causing it. When it comes to acute pain or very sensitized pain, we're used to looking for fractures, we're looking for anatomical disalignment or malalignment. But when we're talking about desensitization or sometimes oversensitization of the nervous system, that's when all bets are off. So conditions like fibromyalgia, which is also really a central nervous system disorder for diffuse body pain, chronic widespread pain, EDS, long COVID, or CRPS, complex regional pain syndrome that may lead to central sensitization. These types of conditions are sending too much stimulation to the brain where it can't process. So what the brain does is it sometimes amplifies that. I like to explain some of this as, when um, you leave a high schooler home for the weekend and they throw a party and they invite one friend and they swear to God it was just one friend they invited. And then you come home early and in the movies they've got 1,000 people in their house, people jumping off the roof into the pool, and the kid is saying, "I really, mom and dad, I just invited one friend." That's one nerve that gets damaged from something. Could be surgery, it could be mitochondrial dysfunction, it could be lack of sleep. One nerve gets disrupted, and it starts to automatically send signaling to other healthy nerves that there's a problem. Those healthy nerves then turn on you, and then they start over amplifying to your brain that there's a significant increase in pain. That then leads to you stop using those body parts, leads to atrophy, swelling, supersensitization of those nerves, and then you have this type of nervous system overregulation or dysregulation. This, can be very challenging to treat, but it leads to a lot of tissue damage.
So, along with the usual medications, there are several that are used in this SNRIs like Cymbalta, nerve agents like Lyrica, gabapentin, which have some role with all of this pain. We use other things like red light, which reduces neuroinflammation. We talked about neural therapy, how it can restore balance by also speaking to the fascia. Infrared sauna, it promotes the parasympathetic activation. That's another role of sauna. It activates the autonomic nervous system and causes the body to feel calmer and relaxed, and it reduces sympathetic overdrive. Magnesium is a wonderful tool for all sorts of pain modulation. It works on the NMDA system and it causes muscles relaxed. It causes you to have less anxiety, less muscle tension, promotes sleep. So, magnesium has a very big role in pain management. And omega-3 fatty acids can be anti-inflammatory. They can speak to they cell membranes that kind of knock off inflammatory proteins from those membranes. And you can have a sense of like calming effect on the nervous system and total anti-inflammatory effect in the whole body. Next slide.
And don't forget the biocharger. That's
And the
great too.
biocharger, yeah.
So nerve pain, it's difficult to treat. It is challenging. We normally go to your Cymbalta, gabapentin, Lyrica type of medications, and then the older school medications, Elavil, nortriptyline, those types of meds. And they if they work, they work. Some type of neuropathies actually respond to certain types of medications. We're now able to do biopsies that can help us figure out which of those type of nerve dysfunction or neuropathies would be better suited to respond to these medications versus other types of treatment. But when the traditional treatments don't work, then we get frustrated. It's challenging. You have peripheral neuropathy, diabetic neuropathy, burning, tingling, numbness that doesn't respond to normal medications. So we're looking at other ways to try to treat that, which could be, improving blood supply, oxygenation, changing the way the nerves are actually stimulated or modulating that with different types of neuromodulation, which could be spinal cord stimulation, peripheral nerve stimulation, but now we're also using magnetic stimulation and radio frequency energy to help change and block how those nerves are sending signals. We can use PRP and exosomes to improve blood flow and decrease inflammation around these nerves. Vibratory stimulation gets these nerves sending signals again, tries to wake them up from a slumber. So there's a lot of cool ways that we are now able to implement to try to get people feeling better. Causes could be things that happen routinely, metabolic changes, diabetes, prediabetes, vitamin or nutrient mineral deficiencies. B12 is a big one, B1, B6, folate, autoimmune conditions, chemotherapy, small fiber neuropathy, post-viral syndromes, most notably nowadays, long COVID. Mold or toxin exposures can mess with your immune system, but also mess with how the nerves are sending signals. EDS-related nerve irritation and compression, radiculopathy due to disc herniations or nerve compression, and then complex regional pain syndrome, which is usually overstimulation of the peripheral and then central nervous system.
Oh, next slide.
Next
Obviously,
slide.
we would try to work towards the suspected cause. So, along with an elimination diet, adding back nutrients, adding neural therapy, acupuncture, maybe adding red light, we can treat things like mast cell activation, which has been very much associated with EDS type of symptom complex. You can support the mitochondria with alpha lipoic acid, the B vitamins. All the PEAs also supports mast cell and things. The supportive treatments like neural therapy can help with the fascia. Mitochondrial supportive treatments like ozone, acupuncture, kind of whole complex of symptoms, treatments that can actually add a little bit to each of the etiologies that we saw before. So we want to evaluate for small fiber neuropathy if, for example, someone has really bad POTS, or if you have persistent tingling, burning, temperature sensitivity, or autonomic dysfunction. So there, do you guys do that at PASS with
We
small
do.
fiber? Okay.
So we do small fiber nerve biopsies. We first start with EMG, nerve conduction velocity studies, to see if it's a peripheral or central cause of a nerve dysfunction. And depending on that, there'd be different treatments. But if it tends to be a peripheral neuropathy, then we want to do a small fiber nerve biopsy to skin biopsy, which is a pretty quick 10-minute procedure that will then allow us to work with the pathologist to better evaluate what's going on with the nerves and helps with actually figuring out which type of treatment options we have. And those could be medications, that could be stimulation, it could be neurostimulation, it could be vibration therapy, light therapy, using regenerative modalities like PRP or exosomes in combination with light and the Biocharger type of treatments, as well as modulating your food and decreasing inflammation through supplements and diet. So this slide here is a nice way to kind of summarize what we've been talking about through the multiple different modalities. We've got the mechanism on the left side and the best fit treatment for that type of mechanism. So a big part, and I love to say, inflammation is the root of all evil. It is where all pain originates from, whether it's damage to a joint, it's damage to a nerve, it's damage to a bone. There's inflammation that's causing pain, and there's so many different inflammatory mediators, whether it's biochemistry, it's nerve signaling, it's blood supply. These all make a big impact on not only how the the pain is actually being transmitted to the brain, but also how you are able to recover. So if we can decrease inflammation, that should be the first and foremost plan. So using an anti-inflammatory diet is self-explanatory. Decreasing inflammatory foods that could cause you pain is a good idea. Decreasing inflammation using different types of medications can be helpful. Using ozone, we're seeing great changes with decreasing ozone. Using infrared therapy, using foods like curcumin and omega-3 fatty acids, all are known to decrease inflammation. Mitochondrial dysfunction, using red light, peptides like SS31, NAD+, CoQ10 are all ways to improve mitochondrial health. Poor circulation, using ozone, infrared therapy, IV therapy with different nutrients, using stimulation, spinal cord stimulation can improve blood supply and improve circulation. Exosomes are great at improving or decreasing inflammation and improving blood supply. For tissue injury, exosomes, the peptides, the glow peptides, BPC 157, TB 500, GHKCU, all good ways to try to get the tissue more blood supply, decrease inflammation, and allow it to heal faster. And then nervous system sensitization using red light, magnesium, omega-3s, all nice ways to decrease sensitization of those nerves so you can send better nerve signaling. And in addition, we also have different webinars that we've talked about covering exosomes, PRP, Biocharger, as well as other topics. You can check out our library on YouTube for anything that you may have missed.
So there's a lot of information that we talked about, and obviously, there's multiple pathways that are involved with the same person. So it is important to kind of understand that pain is not a diagnosis, it's a signal. And the most effective recovery plan is to really identify the dominant biological mechanisms and match them to the therapies that kind of have that mechanism of action. So next slide is kind of what we do at Shakti.
So we've found that combining therapies and layering treatments have given us much better outcomes. For example, starting with an elimination diet, adding peptides, begin restoring tendons with neural therapy can be helpful before we add PRP or exosomes or other types of regenerative therapies. It's almost like priming your body to be able to receive the other types of treatments will lead to a better outcome. Just doing the PRP or exosome in this case first may not give us as good of a response or as quick of a response. And also, we're concerned about duration of relief. We want to make sure that these therapies are giving you long-lasting improvement. Um, and then we will be doing prolozone therapy as well. That will be another way to go after inflammation, mitochondrial dysfunction, in addition to our other regenerative therapies. We want to look at symptoms, duration, and severity. And then we also want to look at diagnostics. We want to be able to see what else we can find as another source that can help us with personalizing the treatment plan for you.
Yeah. And with that concludes our webinar. I don't know if anyone has any questions, or you can do a discovery call with us at Shakti to see if you're a good candidate for any of these things that we're talking about, or do an evaluation. If you're a past patient, talk to one of the providers about some of the things you learned about, see if you're a good candidate. But we definitely want to personalize this. So it's not the same protocol for two people, even if they both have osteoarthritis of the knee. Jake, are there any questions?
Yep, we've had a few that have come in. Everyone, there's a Q&A tab at the bottom. And just to kind of piggyback off of what Dr. Rao just said, we're going to be sending a follow-up email to everyone with a copy of the webinar. You'll have more resources in that email about each of the topics that we've covered, and then also just links to get in touch if you have any other questions. But with that, we'll start our Q&A. First question, well, there's two questions. Is there a way to do a nutrient test or a cost for just that testing? We'll start with that one.
I'm sorry, is there a nutrient? Can you repeat the question?
Is there a way to do a nutrient test for a cost for just that testing? So like just to pay for a nutrient test? It sounds like that's the question.
Oh, I don't know if you can go. directly through their website. The test is called Genova Nutraval. In our practice, we do it for the patients in our practice. I don't know, Sudhir, if you do it for the patients at PASS or not.
Well,
But
so the tricky part of that is you're gonna need a doctor to order it, I believe, and you need someone to review the results. So
it's an 11 to 13 page report and it's very complicated. So I think it's a bit overwhelming to do it on your own, to be honest. It has gut data on it. It has data on mitochondria. It has data on, if you have a mercury excess. So there's a lot of systems that you kind of have to, weed through from the 13 pages that they give you to see like what's your priority, what should you do first, what should you do second. So we usually have protocols of dealing with that test in terms of it's just not 11 pages of raw data. It's kind of like a whole picture of a treatment protocol that you kind of have to put together. So it's a little bit more involved than just like going to a lab core and getting like a B12 level, for example. So I wouldn't recommend that, but I'm not sure if the company has a way to do it without a doctor's prescription.
next question.
What type of magnesium works and for what issues?
So magnesium is wonderful. There's many different types. So the one for constipation can be magnesium citrate, oxalate, magnesium taurate works well for muscles, and so does malate. Magnesium malate works well for muscles. Magnesium glycinate works well for sleep. Magnesium threonate works well for anxiety. In general, you can't go wrong with magnesium because it's just really an essential nutrient and most people are deficient. So you'll know you have too much magnesium because you'll have loose stool or diarrhea. You have to make sure that your kidney functions are normal because magnesium excess in someone who doesn't have good kidney function can be a problem. But in general, most people can tolerate 200 to 400 milligrams. And the maximum dose I go to with my patients is 1,000, or when their gut tells them that they are having loose stool.
Next question we have, and this is the last one we have so far. So if anyone has any final questions, now would be a good time. Does medical insurance cover any of these consultations or procedures?
So we have two practices, pain and spine specialists and Shakti Health and Wellness Center. Pain and spine specialist accepts all insurances and can do traditional medicine therapies. Most of what we discussed today is going to be more on the functional medicine side, which the traditional insurances do not cover. So through Shakti Health and Wellness Center, we have different programs and packages or memberships to try to make it as cost effective as possible while still providing the value and level of experience and expertise that you need for us to successfully tackle these challenging topics.
You can do a discovery call with Shakti Health and Wellness to find out what those rates are and what programs are out there for you.
All right. Well, that's all the questions that we have. Like I said, we'll be sending out an email with a recap of everything we talked about today, and you'll have an opportunity to follow up then if any questions come up.
Thanks. Thank you, everyone,
Thank
for
you, everyone.
joining. Bye.